name is Samana, and the topic that I have chosen to pursue, career that I've actually chosen to pursue is a dental hygienist. I decided to pursue this career in about the 11th grade of high school, and ever since I set my mind on what I really wanted to do, I have not changed the way I feel about it. On this slide, I will talk about the background and occupation, the job description, and some tasks that a hygienist performs on a day-to-day basis. So a dental hygienist is a healthcare professional who is certified to perform oral hygiene examinations on a patient as well as deep clean the patient's teeth, which consists of the removal of plaque and calculus that is built up on the patient's teeth. A hygienist is also responsible in educating patients on good oral hygiene methods such as brushing your teeth 2 times a day, flossing, the use of mouthwash, regular dental appointment checkups. They are also certified to take x-rays of the patient as well as provide preventative materials to the patient's teeth such as dental sealants and fluoride. And just recently, dental hygienists are now certified to provide patients with anesthesia if it's necessary for one of their procedures to numb out an area in the patient's mouth. This is one of my favorite slides, the education part of becoming a dental hygienist. It is advised that students in their undergraduate major in health sciences or biomedical sciences because this really helps to cater for all the sciences that are prerequisite courses for hygiene school. It is also advised to maintain a 3.3 GPA or higher to enhance your chances of getting admitted into hygiene school. Dental hygiene school is a master's program which is about 2 to 3 years depending on your institution, and some courses that really are required for most hygiene schools are classes like organic chemistry, Chem 1 and 2 with lecture and lab, as well as psychology, statistics, and many other classes. It is also important that once an individual graduates from hygiene school, to maintain a practicing license, you have to take an examination. I should have mentioned as well, prior to getting admitted into hygiene school, one would be required to take the GRE, which is considered an entrance examination. Employments and salaries. I feel like this is a really huge determining factor if one really wants to pursue a career in the dental hygiene. So depending on your level of experience and your geographic location, these factors can really determine how much you make. So if you're at an entry level, a dental hygienist is expected to make at about $30 an hour, and this is all these stats I'm going to talk about in this slide are all from the Bureau of Labor Statistics. And once you have about a couple of years under your belt, 5 to 10 years, you're expected to make about $35 an hour. Depending on your location, states like Texas, California, Florida, New York tend to make more just because they have the highest employment levels. This occupation is also projected to grow at about 20% in the next 10 years, so this is very encouraging for a student like me who will be completing dental hygiene school here in the next 5 years, that job vacancies are always going to be available. Working conditions. Okay, some fun facts about dental hygiene. 38% of dental hygienists work full-time and about more than 50% work part-time. I think this is a huge factor, especially for me specifically. I am very family oriented and I do plan in the future of having a family, so if I'm able to work part-time, it's really just going to work to my advantage. Some advantages of being a dental hygienist as well is the flexibility in job scheduling. Since most dental hygienists work part-time, you're able to spend more time with your family. If you'd like to pursue another career, you're capable of doing so because it's not really demanding. And those are really the main two factors that helped me narrow down what career I really wanted when I was battling between physical therapy and dental hygienist. Just being able to create your own schedule and having some time off with your family was a huge determining factor for me. I will now talk about my timeline. I'm currently a junior and I am expected to graduate in the winter of 2019. So this year I completed all my courses with a B plus or higher, and I was enrolled in Intro to Architecture, Intro to Health Professions, Physical Changing and Aging, Sports Performance, and Sports and Society. In the spring of 2019, which is going to expand from which is going to expand from January to May of 2019, I will enroll into my courses and complete those courses with a B plus or higher. And I have listed the courses that I will be taking: Foundations of Food Safety, Sports Nutrition, Physical, Professional Ethics, and Biology 1 Lecture and Lab. In the fall of 2019, I will complete my remaining 12 credits and I will graduate with a Bachelor's of Science degree that fall and walk on the stage. So in the spring of 2020, I will start some shadowing and internships at a local dental office. The fall of 2020, I'll start researching on schools and really just narrow down on what schools I intend to apply to. In the fall of 2021, which is from August to December, I plan on applying to my top 3 programs that I've selected to hopefully get enrolled into the spring of 2022. And once it's spring of 2022 to fall of 2023, I will attend dental hygiene school, either University of Indiana, Florida University, or Nova University. And in the fall of 2023, I will graduate from hygiene school and plan on taking the National Board examination. In the spring of 2024, I will start applying for dental hygiene positions in Florida and begin to practice. Last but not the least is my references. A lot of my references came from the American Dental Association, as well as the Bureau of Labor Statistics, and a couple more. Thank you so much for listening to my presentation.